Hello, everyone. My name is Matthew Zink. I am a Senior Technical Officer with the Going Online team with FHI 360, and I backstop or support our Southern Africa portfolio, which includes the South Africa EPIC project. My apologies that I'm not with you all live virtually. I'm on annual leave today, but still wanted to make sure we were able to contribute to this important session and this important workshop. So it was requested to present on, or specifically to focus on kind of the shift from, or the shift or linkage from online to offline services. So this is a brief agenda of what I will cover in this pre-recorded presentation, and then my FHI colleagues will help facilitate a in-person discussion. So first, to orient us, I'll briefly talk about the virtual approaches across the cascade, and then how we can target the right audience and how doing so, again, increase our linkage and engagement from online to offline services. So more active online approaches that, again, can increase that engagement and increase that linkage and referral. And then provide some case studies from 2 Asian countries, which have high levels of digital connectivity, might be similar to the South Africa context, and where they've specifically were focused on that shift from online to offline services. And then after this pre-recorded presentation, like I just mentioned, there'll be some discussion to focus on kind of the experience of both ANOVA and OEMH, kind of what challenges you're facing, what's working well, what we can implement, as well as other virtual approaches, interventions, and spaces. So this framework or graphic is presenting the virtual approaches across the cascade. And this is how Going Online likes to think about how virtual approaches are categorized across that cascade. So we break this down by plan. So how do we inform and plan our outreach and eventual service delivery? Reach. How do we reach potential clients to then link them to these services? Refer. So again, that kind of linkage from the online to offline services. Delivery. The actual service delivery for clients, whether that is in person or through virtual consult or home delivery or some other decentralized service delivery model. Re-engagement, keeping folks in care, retaining them, whether that's in their HIV or ART treatment or HIV prevention services such as PrEP. And then lastly, improve. So how we're using data to not only improve our service delivery and clinical outcomes, but also our implementation of virtual approaches across those various stages. So today's presentation is really highlighting how strategies in both the plan and reach stages can improve the refer stage. And the idea here is that that we're not only reaching people online, but we're targeting and reaching the right people with the right information, the right messages at the right time in the right way. So if you will, just kind of really effectively reaching those clients in a way that we can enhance that referral and linkage to deliver. So first, kind of focusing on, like I just mentioned, those first 2 stages, plan and reach. How do we know that we are targeting the right audience? One tool that we like to use in Going Online is what we call the quick online surveys. So this is an existing survey tool that Going Online has developed and which programs can adapt to collect data on how potential clients use devices and technologies, so mobile phones, etc., and what kind of online platforms and how they are using them. Get a better sense of the HIV risk profile of audiences that can be reached online, and then how those respondents want to receive HIV and sexual health services and information. So our standard tool is about 35 questions, and again, all of the content can be adapted to local context, as well as removing questions or adding questions based on the both the local context or the specific needs and purpose of the survey that you are designing. Typically, we use SurveyMonkey to administer these surveys, but any online survey tool could be used. And various outreach strategies can be used, whether that is social media campaigns, organic posting on existing social media platforms or pages, SMS blasts to previous clients or respondents, as well as kind of mixing with offline strategies of going into the community to physical hotspots, community events, and kind of having outreach workers with tablets, for example, doing some data collection with potential respondents. And so these survey results can help inform the efficient and targeted online HIV outreach, as well as how we deliver those services. So survey results can give us a better sense of, what platforms potential clients are using, where they like to receive this type of information, what topics or influencers or pages that they like to engage with on social media, and again, what their HIV risk profile is and their understanding around HIV risk. So that way we can tailor messages and content that we disseminate on these online platforms in a way that satisfies both their desires around how to receive the information, but also their needs in filling those various education or information or service gaps that they're experiencing. So these are just some kind of sample and example survey results from a recent online survey that we administered in the Philippines. So these next couple slides will just show some charts that are focused on kind of that technology use and online platform use. So you see here, this first one, it's showing the results for the question of which application do you use on a daily basis, select all that apply. And so here we can see the breakdown of the various different mobile applications that respondents are using, and having that disaggregated by all respondents and specific key populations, including MSM, transgender women, and young key populations. And you see Facebook Messenger is the most used, and then Facebook and going down, but there's slight variance by those disaggregated groups. We can also see which application which application that they would most like to learn more about sexual health or receive support from health service providers. Again, the various apps and that disaggregation. And now this graph is displaying the results for the question related to how respondents prefer to communicate using their phones. So whether that is messaging on a messenger app, for example, Facebook Messenger, WhatsApp, etc., traditional SMS messaging, voice call, video call, etc. So this question is helping give us insight of, hopefully once we have gotten initial engagement from potential clients, how we can continue to follow up with them, and then also once they're engaged in care, how we can follow up with them. So again, these are just some brief graphs from a few types of questions that we can ask in these online surveys, but the online surveys ask a number of other questions or focus areas, asking them about kind of how they use social media, what topics they like to engage with on social media, if there are specific platforms or influencers that are important to them, as well as a number of questions related to their HIV risk profile and understanding of HIV and sexual health services. So all of this together, again, can help us inform not only how and where to reach these clients, but to provide them with information that meets both their desires, but also fills their informational or service delivery gaps. Another activity we can do to improve our targeting and kind of reaching the right audiences is called social media mapping, which is an activity that helps us find and list the online places or people that can be used to target or to reach target audiences. And so we call these online places or people sites. And once we've identified these sites, we can plan and prioritize outreach by various factors, including the number of users on each site, the types of users on those sites, the kind of overall engagement, so frequency of posts and activity, as well as the kind of type or purpose of the content posted. We can, through this activity, better understand the online audience size by seeing kind of the membership, followers, number of users in these various different platforms, whether it's Facebook pages, WhatsApp groups, social media influencers, number of followers they have, etc. And then the activity uses a relatively simple mapping tool via Excel that can provide information for social media pages and groups, influencers, and then group chats and messenger applications. So typically this activity is done kind of in a group workshop. And the first step is for participants to list out before that, the first step is to define what those target audiences are. So this could be, what are the specific key population groups, or even within key population groups, are there kind of subpopulations that you are specifically trying to target? And then once you've defined those target audiences, you will start to, or participants will list out kind of all of the existing social media pages, influencers, group chats that they're already aware of in the Excel tool. And then from there, doing social media searches to identify new pages and content that you were not previously aware of. Depending on various factors, including your existing knowledge and the kind of social media landscape, if you will, this activity can take anywhere from 1 hour to several hours to complete. It is probably impossible to achieve complete saturation of identifying all the various social media sites. So once it kind of gets more difficult to identify new sites, when you're doing the searches is kind of what we recommend to kind of end the activity or set what your predetermined amount of time is, and then you can go from there. So these next couple slides are just highlighting kind of the various what the kind of structure of the various Excel sheets in this tool would look like. So again, as I just mentioned, it's 3 main tabs. So one focused on social media pages and groups, and it has the name, link, platform, type, number of followers, geographic scope, content purpose, activity, and the option to add any comments. And then similarly for social media influencers, identifying the name, their username, what platforms they're on, a link to their profiles, the number of followers they have, the types of followers, the content that they're producing or the kind of purpose of their pages, the activity and engagement. So how many posts are they making? How many people are engaging with their posts? And again, the option to add comments. And so the last tab on the social media mapping workbook is related to group chats and messenger apps. So you can identify the group chat name if the admin contact is publicly available, so that way we can potentially kind of communicate with them to get their buy-in. What platform, the number of members, and kind of the type of members or followers, the content or the purpose of these group chats, and what the engagement is like. How often are people posting? In summary, in this one, again, the purpose of this activity is to really give programs a much more comprehensive understanding of the social media landscape related to their specific target audiences and populations, and then from there prioritize both in using it in combination with the other activity we just discussed, the quick online surveys, where we kind of defined what is the right way to tailor these messages and how to reach these potential audiences. And then the social media mapping can give us a better understanding of where that actually is, and kind of where we see different numbers of users and how they're engaging with that content. Another approach that we can use to potentially improve our reach to the right audiences is dating app density mapping, which is an activity that can help us visualize the density of dating app users within select urban areas. And then once that is done, we can identify and prioritize locations for virtual outreach on dating apps, whether that is through more active approaches like with online outreach workers, or to help us target ads on those dating apps to users in high density areas. And then we can also compare with physical hotspot mapping to see if there's efficiency that we can do with both the online and offline outreach methods. So how does this kind of work? This approach is compatible with geo-based dating apps, for example, Grindr, but others include Hornet, Scruffed, Blued, Jacked, and other apps that basically display a list of nearby users in order of proximity or location. We have an Excel tool where you take systematically sampled list of coordinates that cover a selected urban area, and then kind of add the number of online dating app users within a 1 kilometer radius of each coordinate. The way the technology is, the technology that we use, you don't actually need to like physically be in that GPS location. So this could be done in other locations, and you kind of use GPS coordinates to set them to other locations. It uses ArcGIS or another GIS software to select that urban area that you want to do the density mapping, and then plot a grid of points across that map. So those are the points that you'll use to then do that 1 kilometer radius to count the number of users. So you would also need to, on an Android phone, have the whatever dating app that you are looking to do the mapping for downloaded, as well as an app called Fake GPS. And then on a laptop or desktop computer, you have Google Maps open as well as the Excel tool. And then in the Fake GPS app, you would enter the GPS coordinates that you've identified via ArcGIS, open the dating app, and refresh the screen to list the profiles in proximate to those coordinates, and you would count the number of profiles within the 1 kilometer distance into that Excel sheet, and then you could repeat for each coordinate that you've previously identified. And then this process can be repeated at various times, whether in the day or over the course of a week, to see if the density changes based on that timing. Now I want to talk about some kind of quote unquote more active online approaches that we can use to reach and refer potential clients for services. So the first is what we call social network outreach. So this is a higher engagement but narrower reach approach. It is implemented either by online outreach workers who are trained staff or peer mobilizers who can be volunteers or be provided incentives based on different, whether that is monetary compensation or other incentive-based compensation. Within this approach, within this strategy, there are 2 approaches. The active approach, which is where those online outreach workers or volunteer peer mobilizers are conducting one-on-one online conversations with potential clients to provide education, HIV risk assessment, referral, and counseling support. And again, this is leveraging the work that is done in some of those previous plan activities, whether it was the social media mapping or the dating app profile density mapping, to kind of go onto those relevant platforms and sites and outreach to clients directly or potential clients directly. And the first ask doesn't necessarily need to be to book services. It can be to provide education, or to do like a kind of callback option where the online outreach worker can set up a phone call or a video call to kind of talk about different HIV services and kind of build trust with these potential clients. And then from there, kind of try to move them along the cascade pathway and get them into service delivery. And then there's also the passive approach, which again would be implemented by either the online outreach workers or those peer mobilizers. And this is when we've identified those social media pages and groups. They're kind of more passive members of the groups. They'll be posting about HIV services or information, and try to get other members of those groups or pages to engage with the content that they've posted, and maybe then reach out to those individuals to kind of shift them into the active approach that I just described. Another approach is the virtual EPOA, or Enhanced Partner Outreach approach. So you might be familiar with this already, and essentially it is just using QuickRes or another online platform to facilitate this process. So you would identify a certain number of quote-unquote seeds at your site. So these are individuals who have received HIV testing services and then are linked into care. And then each of those individuals is given a unique token link to QuickRes, or in Anova's case, this would be Ivan Tom's. And then those individuals use their unique links to try to get other peers or people in their network to book HIV testing services. And some of those new clients that have come in from the seeds could be identified as peer mobilizers. And then again, those peer mobilizers are given their own tokens to encourage other peers to book services. And then you can provide incentives or compensations to both the seeds and peer mobilizers, and kind of set that structure up based on kind of receiving compensation once a certain number of individuals have received or come in for, or like new clients have been enrolled or received certain services. So yeah, this leverages both the kind of online approach and technology with the peer mobilization to try to increase that higher level engagement and linkage into services. So now I want to provide a couple examples of how online outreach strategies were used in Asia to link clients to offline services. So the first example is in Thailand, and kind of they were specifically looking at the various different online or how the various different online channels they used resulted in uptake of HIV testing services. So in their context, Facebook was prioritized for paid advertisements due to its higher volume reach, and this led to the highest volume of arrivals among all channels. However, they also partner with Blued, which is a dating app, to run online ads as well as offline events. And this actually led to the highest case finding among all channels, and kind of having that hybrid approach of both online ads as well as partnership development and engagement in offline community events. This graphic is a little bit hard to read with all of the colors, but it's just showing the case finding by the various online platforms that they used in Thailand, which included various different dating apps, messenger apps, and social media pages. So yeah, you see again that Blued had kind of a lower overall volume, but a much higher case finding, and then some of the other online platforms, the various breakdown of their negative HIV test results, positive, and then the case finding. In the Philippines, they used what's called a surround sound marketing approach. And so this is when clients or various different online outreach strategies are used to reinforce and reiterate messages from various different channels and messengers. So interestingly, they found that online ads led to 65% of the web traffic on QuickRes, but only 1% of that traffic was converted to book an appointment immediately. So this means that potential clients saw an ad on Facebook or on a dating app, and they did click to go onto QuickRes right away, but they didn't actually go to complete their appointment booking. However, using these various different online outreach methods and reaching the same audience multiple times potentially led to a high awareness from online ads, which then contributed to later gains in organic bookings and improved conversions. So by organic bookings, we mean something that we haven't paid for, and kind of the client found their own way to QuickRes, if you will. And so in the Philippines, 85% of appointments booked on QuickRes were via this organic leads. 31% of organic web traffic continued to book an appointment. 63% of organic bookings arrived for their first appointment, and 86% of all HIV testing services positive cases were identified organically. Sorry about that slight delay. So this table, and sorry that it's partly cut off, is showing the client flow by marketing channel. So again, as I just mentioned, the direct or organic traffic led to the highest number of bookings, arrival, and service delivery, but kind of web traffic was highest from those paid advertisements, either via social media or Google, but a very low conversion rate. And then also use some influencer promotions, client referrals, and then some offline community and thematic events. So for these are summary graphs showing the comparative results for online service cascade HIV case finding in both of these examples. So you see the purple bar for each is showing the total number of online referrals, and then the second bar is showing the arrivals and disaggregated by key population type, so MSM, transgender people, female sex workers, others. And then the third bar for each of the graphs is showing the HIV case or testing results. So the number of negative and positive cases and the case finding. So in Thailand, it resulted in an overall case finding of 3%, which was slightly more than the 2% case finding from the in-person outreach. And then in the Philippines, had a case finding of 6% compared to an over or 6% from the online sources compared to an overall of 3.4% from the overall program. So that is kind of the end of the content for the pre-recorded session. So I'll quickly show the discussion questions that you all will engage with in person. So first, we'll focus on kind of what are you currently doing related to online outreach and marketing? What strategies are you trying to implement to maximize the linkage from online to offline services? What have you found to be successful, if anything, so far? And kind of what are some challenges or pain points you've encountered either with these approaches that you've used so far, or just that maybe have prevented you from even being able to implement certain approaches. And then kind of more broadly, are there virtual approaches or interventions you are interested in at different stages of the cascade? So again, we talked a lot about plan and reach. So is there anything there? Or other stages, including refer, deliver, re-engage, or improve? Do you have any other ideas for virtual approaches or interventions that you would like support or potential technical assistance around? Any future trainings, workshops, or learning events? Recently in a meeting with Out EMH, we talked about potentially trying to organize a cross-program learning event with some of these Asia programs, especially because they may also be doing some work with ChemSex, MSM coming up. So there might be opportunities for cross-learning. And then lastly, these are just some links to some resources to existing technical briefs on some of the various approaches that we discussed. And then we can also share the virtual EPOA methodology on request. So thank you so much. And I hope you all have a fruitful discussion, and I look forward to hearing about the discussion and reading any notes or key takeaways of how we can support you in implementing various virtual approaches across the different stages of the services cascade to improve our reach to potential clients, their referral and linkage into services, and then the service delivery that we are providing to them. Thank you so much.